Primary healthcare apparently is the foundation of healthcare systems around the world, providing a level at which non-emergency preventative health issues should be managed or resolved. It is the first level of contact of individuals, families, and communities with the national health system. This means that communities must be able to afford the cost of healthcare at these centers to avoid more serious and expensive tertiary healthcare in hospitals. Reports show that only about 20% of the 34,000 primary healthcare facilities across the country are fully functional. The rest are hardly able to provide essential primary healthcare services due to many reasons, including poor staffing, poor condition of infrastructure, and lack of essential drugs. Also, the increasing brain drain and deficient sizes of the health workforce has put a major strain on the PHC system. How can Nigeria surmount these challenges for a more sustainable healthcare system? On this episode of Late Edition, we shall be discussing revamping primary healthcare in Nigeria, among other issues. I am Ekene Ndulue. Thank you for joining us. And with me in the studio today is Dr. Salma Ibrahim Anas. She is the Special Advisor to the President on Health and Chair of the Presidential Advisory Council Subcommittee on Health. She is a medical doctor and public health physician with over 30 years' experience in public health and humanitarian crisis response at state, national, and international levels in the Federal Ministry of Health. Dr. Salma established the Pioneer Program for HIV treatment and prevention of mother-to-child transmission of HIV, as well as coordinated the first round of proposals to the Global Fund for HIV, TB, and Malaria, where Nigeria first benefited in 2001. She later served as a Global Fund Manager for HIV, TB, and Malaria under the National AIDS Control Agency. She has vast experience and expertise in health systems strengthening, with specific focus on primary health care and delivery of productive maternal, newborn, child, adolescent, and elderly health, plus nutrition, including gender-based violence. She was also, at one time, the Director, Head of Hospital Services, Federal Ministry of Health. Glad to have you on the program, ma'am.
Thank you so much.
All right. Like we mentioned during the intro, that Nigeria has about 34,000 primary health centers, making up about 85% of total hospitals and clinics, underscoring how important this is to the healthcare system generally. Can you reiterate how important the primary healthcare is?
Yes, so thank you so much, and good morning, everyone. The situation is true, as you clearly stated. So primary health care is very important and very critical component of delivery of healthcare services. For Nigeria, the federal government, under the leadership of President Bola Ahmed Tinubu, is committed under the Renewed Hope agenda to ensure that we attain universal healthcare coverage where no one is left behind. And this cannot happen without strengthening and revamping the primary healthcare facilities, because that will be the platform for the delivery of healthcare services. As you rightly mentioned, ideally, more than 80% of Nigerians should have access to primary healthcare for their healthcare needs, within their reach. So within maybe less than 30%, it's work within their own communities. They should be able to have access to quality basic minimum package of healthcare services. So what does that mean to us? It means that every primary healthcare facilities must be functional. And functionality means not just about the infrastructure, the building, but also effectiveness in terms of human resources that are available 24 hours a day, throughout the week, day and night, in the right mix. You must also have the basic minimum equipment at that facilities. You must have the basic drugs, essential drugs that will cater for more than 80% of our health needs in Nigeria. So all those must be there. And then when you look at the infrastructural side of it also, that facility must have good spacious, with good air ventilation that guarantees confidentiality and privacy of your patients. It also must have electricity, of course, to maintain some of the equipment that are there and to provide light for people to be able to do the basic examination and conduct basic services like conduct deliveries. It must also be secured. Security is an issue. So today we are talking about PHCs must be protected, must be secured, must have security around it so that families, individuals will be comfortable in accessing services, because services are supposed to be there day and night. Okay. And majority, especially if you take the component of maternal health, majority of deliveries take place in the night. So that shouldn't be a barrier. So, and then water supply, I didn't mention that. It must have adequate potable water supply, because this is also one area that was found to be a barrier to accessing services at the PHC level. So in a nutshell, I would say that this administration is committed to revamp that, and it ensures that it functions and forms a critical component of delivery of healthcare services in Nigeria.
Okay, it is also worrisome that looking at how essential the primary healthcare system is, that just about 20% of them are functional across the country. How concerned is the present administration about this, and what is being done in this regard?
So as I mentioned earlier, this administration is concerned about that, and it has prioritized effectiveness and functionality of primary healthcare facilities as one of the critical priority areas to deliver by this administration within the next few years available to us. And we've already jump-started working on that. So what have we done? And I'm glad to mention that the previous administration, if you look at the National Health Act, which Nigeria started pursuing for almost 20 years ago, it was operationalized by the previous administration. In 2018, it was operationalized. And what does that mean? It meant that 1% of the consolidated revenue will be allocated or dedicated to strengthening our health systems. Okay. And the primary health care will take at least 45% of that allocation to ensure it strengthens the primary health care facilities and support states. Let me mention that categorically. It's not a replacement funding for the routine funding of facilities, because PHC is supposed to be responsibilities of state government at subnational level. However, because of the huge gap that exists, the federal government has dedicated resources, 1% of the consolidated revenue fund, which we call the basic healthcare fund. And about 45% of that is going into strengthening the primary healthcare facilities, including whatever need that the state feel gaps are there for the state for the federal government to support fill that. So that is one stream of support that is already ongoing. And I'm glad to mention this administration has also increased that resources and support for that. And the other hand of it is through the National Health Insurance Authority. So we have also expanded the coverage of vulnerable people. And then within this basic healthcare fund, about 50% of it is going into coverage, expansion of the coverage, to provide a financial protection for Nigerians that are vulnerable, that cannot afford services. And when you talk about vulnerability, significant proportions of Nigerians are vulnerable, because looking at it the other way, you will note that over 72% of Nigerians pay for services out of pocket. So, and a lot of them cannot afford that. So this will provide a kind of financial protection to those that cannot afford, and cover and expand that. And who are those people? You might like to know that most of the vulnerable people.
I wanted to ask about that. How do you identify those, and how can you implement this effectively, providing financial cover for those that are vulnerable?
So those have been identified, vulnerable people, and if I may give them the categories, majority of the vulnerable people are women and children under 5 years. They are women of reproductive age groups between the ages of 15 to 49 years. And they are children from 0 age to 5 years old. They are vulnerable people. And then the poorest of the poor within communities, which constitutes almost all the age groups, including the elderly people. And then you looked at also the people that with disabilities that do not have any meaningful way to earn a living. They are vulnerable people. So if you look at those people, they constitute a significant proportion in Nigeria, the vulnerable populations, and they cannot pay for services. So at least if you look at the whole of our healthcare delivery, most of the health needs of Nigerians, more than 70%, are basic health needs that could be managed at the primary healthcare level. So when you cover that, it's like you've covered almost 70% of the health needs of Nigerians, you know, at a cost that is readily available. This is just a booster from the federal government, and then with support from the state government, it makes healthcare very available, the essential basic healthcare services. So this is it about. So it's a joint relationship between the insurance agency and the primary healthcare agency, and this is also decentralized at the subnational level. Remember, states also have their own state health insurance authorities, or some call it contributory health scheme. The way the state government want to design it, it's all based on their own needs and the criteria they've come up with. But of course, they are guided by the federal government. And then we have the state primary healthcare board that also have the primary healthcare, supervises the primary healthcare at the state level up to the local government level. So this is the structure that exists, and this is some of the mechanisms put in place for several years. You know, if I may go back to the story of primary health care, yes. You know, we call Professor Olukoya Ransom-Kuti as the father. So since the establishment, the declaration that countries should establish primary health care to bring access to care, quality care close to the people, yes. So that they can readily access this and then improve their health. And this started in 1978 at the Alma Ata Declaration. And luckily for us in Nigeria, we have Professor Ransom-Kuti, who pioneered it for the first time in Nigeria and started establishing the primary health care in every state of the Federation. And for us, we have been building on that legacy of our father, you know, the father of primary health care in Nigeria. Yes. Exactly, Professor Olukoya Ransom-Kuti. And we are still yet to reach where we are supposed to be. The journey is still on. Okay,
you mentioned you identified some people considered as being vulnerable members of the society. There are also some that are not within this category that make out-of-pocket expenses to get medical attention, like those working in informal sector, some working in the private sector that are not covered under the national health insurance. Like records show that it's just about 5 to 7% of Nigerians that are covered under the national health insurance. What is the administration doing to ensure a more comprehensive coverage of Nigerians?
Yes, so that has been addressed already. It was in the past, and that because the focus in the past was, you know, insurance started in Nigeria for almost 20 years, but we've not really made a headway in terms of making it accessible and covering large populations of Nigeria. So I'm glad to mention that was reviewed in the last administration, where it becomes mandatory. So every Nigerian now have equal access, whether you are in the private sector, whether you are in the public sector, and whether you are in the formal or informal sector, you have a right to be covered under the insurance scheme. And then some opted for private sector insurance coverage. So this has been addressed, and that was what led to the review and the bill that was passed on the Mandatory Health Insurance Act, which now transformed the National Health Insurance Scheme to the National Health Insurance Authority. Exactly. So now we have the authority. So I think what we need to do more now is enlightenment, education, because most Nigerians are not aware that this exists. So we need to educate Nigerians. We need to inform them. It is a responsibility that they have to take. It is a right that they have to take to ensure that they access healthcare services, that their health is also covered and insured. And there are different mechanisms that the insurance agency has come up with, which they are beginning to roll out and to ensure that it increases our coverage. And a lot of states on their own have started boosting that, and I have seen states like Jigawa State, they are doing that. I was in Ondo, and I saw also the state governor has also scaled up the coverage of insurance. Borno State is another state that has also enhanced the coverage of the state insurance, health insurance. Yes, under their state health insurance, under the leadership of the state governor. So a couple of states are already implementing that and rolling out.
Okay, could there be a legislation, mandating employers to ensure that their staff, maybe people that are employing have up to 10 employees, especially in the private sector?
Yes.
Wouldn't that be more effective?
That is what the legislator is talking about. And then we have now the National Health Insurance Act, which clearly spelled out and made it mandatory. So it's not optional anymore. So I think that will be that will be very useful for Nigeria to increase our coverage of the vulnerable people to access essential basic healthcare services. Okay,
if I'm not mistaken, your office drafted the policy document on the current administration's reform in the health sector. We'd like you to talk about this. Give us an insight.
All right, thank you very much. So let me move back a little so that I give you the background of the whole thing. So my office is Office of the Special Advisor on Health to the President, which is a new creation for the first time in the history of Nigeria. President Bola Ahmed Tinubu, in his own wisdom, created that office to complement the efforts of the existing structures that we have, which is the Federal Ministry of Health and its parastatals. So the aim is to advise the President promptly on what needs to be done to improve our health sector, and also to support the Federal Ministry of Health in realization of the President's mandate. So President Bola Ahmed Tinubu, going back to pre-election, he made promises because he is someone that is so passionate about health. And we are all conversant and aware of the work he did in Lagos when he was governor of Lagos State, especially in the health sector. The health sector stood, and it was very clear they were achieving a lot as of that time. So continuing with the legacy of what he did pre-election, we came together, myself and Dr. Jide Idris, who served as his commissioner at that time when he was governor. And we said, let's see how we can work together to bring health to the agenda of President Bola Ahmed Tinubu and a prioritized agenda of the administration, because without health, we can't achieve anything. We've seen the effect of COVID on health of Nigerians. In fact, not only Nigerians, globally, how it has grounded economic activities. So pre-election, we came together and formed what we call the Health Transformation Coalition for Nigerians. And the whole idea about that is to prioritize health agenda and to pick from the commitments of President Bola Ahmed Tinubu, what he wants to achieve in the health sector. And then we put them as a mandate, and those became his campaign promises as of that time. So we used those campaign promises to do two things: to engage with stakeholders across the country, across the 6 geopolitical zones, to find out from them, and they also get their contributions. So we got a lot of responses from the engagement that we have had, including civil society organizations, our private sector were involved in those engagement, development partners, community leaders, religious leaders. So we did in the south, in Lagos, we did in Kano, we did in Abuja, and then states also went back because we had people at the state level that we are moving the agenda forward. So we came up with a refined campaign promises, and those were the campaign promises that President Bola Ahmed Tinubu made to Nigerians, around 8. And we also used that tool to canvass for votes for the president, because the health sector is a huge industry.
It is.
It's a huge industry, and I'm glad to mention, being a woman, more than 70% of those in the health industries are women. If you look at it across, starting from the medical doctor, the laboratory scientists.
That means women are not marginalized in that
No,
area.
they are not, because it's really work. It's an act of saving lives, an act of caregiving. And women are already into those, by default, that has been the responsibility of a woman. So the nurses are there, the laboratory, the community health extension workers, the junior community health extension workers, the volunteer health workers, significant number, up to the level of the hospital attendants were carried along.
Okay.
So we canvassed for votes using those campaign promises, and I'm glad that it came out victorious at the end of the day. It was a significant contribution from the health industry. So post-election, President Bola Ahmed Tinubu established the Presidential Advisory Committee on different health sectors of development, and health is one of them. So I was asked to chair the Committee on Health. So we picked from the campaign promises because he said he wanted to achieve. He wanted to ensure that he realized those campaign promises around the 8 thematic areas that were prioritized. So the committee, we worked on that assiduously. And then around the 8 priority areas, which are, let me quickly mention them if time will allow us.
Yes, of course. Go ahead.
Thank you. So the 8 priority areas, one was about governance issues. We must have good governance in the health sector because we are dealing with life. And accountability mechanism, we must institutionalize accountability framework within the health sector. Whatever we are doing must be transparent, must be effective, because you are dealing with the lives of people. And then we also have to look at other legislators and bills and review them to ensure that all these are done. So that is one aspect that look at all the issues around governance and institutional arrangement, not only at the national level, but also at subnational level, so that we avoid the issues of fragmentation, silos implementation, working in an harmonized approach.
There should be synergy.
There should be synergy and complementarity in whatever we deliver in the health sector. When you have partners supporting you, it should be harmonized. It should be within the priority areas. So that is one domain, the governance. Then another aspect of it that we've also looked at was on human resources gaps. So Nigeria is undergoing a serious challenges around human resources. And when I talk about human resources, there are those categories of health workers that I have mentioned. So a lot of Nigerians are migrating abroad, but even without the migration, our production is not commensurate with our needs. So we need to do more in terms of increasing the production of healthcare providers in Nigeria. Let me just pick example of one, the medical doctors. The WHO recommendation is 1 medical doctor to 600 population. But what we have today is almost 1 to 6,000.
A very huge
which
deficit.
Is grossly inadequate and can lead to burnout of the medical doctor. So we need to do more. So all this domain, health worker category is all the same all throughout. So we need to revamp. We need to bring in even private sectors to be part of the improvement of production of health worker, and also the quality of services that needs to be provided. We must improve on our capacity building of our health, because in medicine there is nothing that is one and forever.
Yes.
Things keep evolving.
Improving.
Exactly.
New
because
ways
it's
of
science.
doing things.
It keeps evolving. So we need to continue to unfold and continue to build capacities of our healthcare providers based on the new emerging issues that are coming up in the health sector globally. We need to meet the standards of practice. So that is number 2 of it. And then the third one is about the service delivery. And I did mention the quality. Okay. So Nigeria operates at 3 levels of care. The primary health care, which is supposed to serve more than 70% of Nigerians. The secondary level of care, which is supposed to serve like 20%. And the tertiary, which is supposed to serve less than 10%, because it's supposed to be specialized care. But what do we have today is the reverse. People run to the teaching hospitals and federal medical centers for headache, to treat malaria, simple things. So
jumping the primary and going to the secondary.
Because the primary health cares are not functioning effectively.
Yes.
So what we said is we should have a model of integrated healthcare delivery. And all of them, before, they just operate in silos individually. So there should be connection between all. The tertiary facilities have huge resources of capacities that are grossly underutilized. If you go to your state and look for the teaching hospital, you'll find most of the consultants that are specialized, they are all in the teaching hospitals. The secondary facilities have limited, maybe none even at the primary health care. So we need to have integrated healthcare facilities whereby the tertiary institutions supports the secondary level of care and the primary health level of care. They can support them with capacity building, training of the health workers, mentorship, even providing hands-on services to the health facilities, because that is why they are there. They are there in addition to training, service production, and also a conduct of research and development. So we must have a model that builds around that to support and improve our quality of care services. Then the another area that we thought also is very important to realize the campaign promises of President Bola Ahmed Tinubu is around the local manufacture, because President is very concerned that Nigeria should produce and manufacture their drugs. We have to run away from gross importation. As of today, Nigeria imports more than 70% of the drugs that we consume, and we are one of the largest consumers in Africa.
Because of our population.
Because of our population. Oh. And even when you look at it, the active pharmaceutical ingredients, we import 90% in Nigeria, even those pharmaceuticals that are produced in the field. So we need to reverse that. And President Bola Ahmed Tinubu is very committed to that Nigerians must reverse and even be an exporter to other African countries and beyond African countries. Okay. So that is a priority, that we localize production, we transfer skills and technology that will enable us to start local production of our drugs, of our commodities, including even assembly of sophisticated medical equipment. So all those are possible with the level of commitment that we have. So another part of that.
Okay, we'll quickly take a short break. We'll come back to that.
All right.
Yeah, we've gone midway into the program. This is Late Edition coming to you from NTA News 24. We'll continue shortly after this break. Stay with us.
NTA News 24 has the sole mandate of bringing news to you anywhere and everywhere.
We set standards based on current broadcast realities while consolidating on a wider reach to variety of audiences.
We go beyond the screaming headlines to verify, interrogate, and accommodate all shades of opinion without prejudice to national interest.
If you are just joining us, this is Late Edition on NTA News 24, and we have been speaking with the Special Advisor to the President on Health, Dr. Salma Ibrahim Anas. Dr. Salma, before we went for that break, you were talking about several aspects of the reform of the President Tinubu's administration. You've spoken about four. Yeah. Now, we talked about the governance, accountability, service delivery, and local production. Yeah. Okay, what's the fifth aspect?
So the aspect, again, that I'm talking that we have prioritized in line with his campaign promises is about data management. If you don't know, you don't generate data, you don't know where you're coming from, and you don't know where you're going to land. So this is critical component of what we need to strengthen at all the levels, right from the local government level. We need to have a robust data management systems that will fit into the national level to tell us the journey. And of course, things are much more simplified now. You can deploy technology to be able to have robust data that will guide our policy formulations and also our program implementation. That is a priority area that is well prioritized, and the use of modern technology. Then another area we talked about is our public health emergencies, which fits into the global security issues in Nigeria. And Nigeria have learned a lot of lessons in the recent years. If I step back and talk about Ebola, Nigeria did very well in responding to the Ebola. And also with the COVID pandemic that happened in the last few years, Nigeria also responded effectively. And we have also seen our position globally in terms of threats, where even the developed countries are faced with their own challenges. Yes. And that is to tell us that we have to be self-reliant, we have to be independent to ensure that we step up action around our public health emergencies and strengthen the mechanisms up to the subnational level. So I'm glad we have the NCDC today, the Center for Control of Control of Diseases in Nigeria, yes. Exactly. And they are up to doing a lot at that level to ensure that they also transfer skills and technology and strengthen systems at the national, at subnational levels, whereby we can easily detect and respond promptly to ensure that we avert epidemics, including epidemics in Nigeria, and pandemic that may occur. So that forms part of our efforts towards global security. Then partnership. You know, Nigerians have a lot of partners that support us, development partners, even civil society organizations, and now individuals are also coming up to support. We know what Dangote is doing a lot around that, and several other partners, including the private sector. So we need to put it in a perspective of partnership and harmonized approach, so that you don't have a partner doing things differently outside the vision and priorities of the Renewed Hope Health Agenda. So all these are being put together and harmonized as one approach that fits into our vision, so that it complements each other. So I'm glad to mention that when we had the new ministers, we handed over to them and then briefed them in depth on how to carry it forward. And I'm glad that they are working towards that, where the current minister has come up with the model of implementation to realize the 8 priorities of President Bola Ahmed Tinubu under the 4-point agenda, which he has put it together. The governance issue is also part of it. You have the global health security, you have also the population and all that, the partnership. So I think the journey has just started, but we're very optimistic. If we remain committed to it, it's something that Nigeria can realize and can lay a solid foundation for the growth and development in the health sector.
All right, Ma. Just this month, President Bola Ahmed Tinubu approved the establishment of the National Health Fellows Program.
Well, yes, that is the minister. It's part of the efforts to boost capacity development in Nigeria, and also to increase production of and also to build capacity, but at the same time as part of mechanisms of accountability within the health sector. So it's a new initiative that was initiated, and it's been handled by the Honorable Minister of Health. Okay,
when you were speaking earlier, you talked about the way medical practitioners are migrating from Nigeria to seek greener pastures elsewhere, the Japa syndrome, which is invariably affecting healthcare in Nigeria. How do you think this can be tackled?
Yes, so it's true. Nigeria is suffering greatly from the Japa syndrome. So one can look at it positively and negatively. You've said that already. Yes. The negative side of it is true. It's affecting grossly on our healthcare deliveries. But not only doctors, across all the health professionals, they are leaving. Nurses, midwives are leaving to developed countries, mostly United Kingdom, and then Canada and US. Anyway, so let me look at it quickly, the positive side of it. You can't migrate if you don't have the quality. So Nigerians, we should be proud. Our production, our quality of training is up to global standards and is one of the best that is recognized. And I must appreciate our teachers in the health industry for doing a great job and maintaining that standard. Because if they are not good, they are not qualified, nobody will take them. Nobody will take them, yes. And today a health worker can decide, I want to be in another country, developed country, without a visa. They give them visa upon arrival. So that shows that part of it. But for us, on the negative side of it, you have said it, we can't afford to continue to lose our medical workers. So a lot of negotiations are ongoing at country level and also at global level. Some of which I have mentioned at country level is to also, of course, even without the JAPA, we are grossly inadequate. So we need to increase our production of health workers. And then we are also attracting private sector. A lot of them currently are being licensed to establish schools of trainings, and they are already doing it in most states of the federations, so that we boost. One area also is the training of the nurses and the midwives, and that's another area we have a huge JAPA syndrome. Midwives and nurses, a huge JAPA syndrome. So now we have also increased the level of production, which goes with an increased infrastructure and also capacities to be able to train within our institutions, and also licensing of some of the private sector. And then the Federal Ministry of Health is also working at the global level to ensure that how does Nigeria also benefit from the Japan syndrome. So a lot of efforts are ongoing to see that how we attract. But you know, another important thing, when you speak with the health worker, they talk about the working environment.
Yes.
That is not conducive, they don't have the tools to work with, and we do agree with them, because the same Nigerians, if you go abroad, they are the ones delivering healthcare services of best standards. I have seen a woman that have traveled, that left Nigeria for a spinal surgery, only to go and meet her medical doctor in that country.
Another Nigerian.
And the same Nigerian she left to do the surgery successfully abroad. So we see all kinds of things happening. So, but this administration, under the renewed hope agenda of President Bola Ahmed Tinubu, is committed to also create an enabling environment to strengthen our health facilities with diagnostics, with their therapy, radiotherapeutic equipment, to make it conducive for health workers to have the tools to work with, so that they will have that self-satisfaction in providing a quality healthcare service. So at the tertiary level, you've had the Ministry of Health is strengthening facilities, is also equipping health facilities with state-of-the-art modern equipment across board, including cancer therapy and diagnostics, and also building capacities, not only at the national, but also building capacities of frontline healthcare providers. Okay. So this is already ongoing in the country. It has already been passed, and the implementation is already ongoing. But you know, these are federal government efforts, and health sector is not only responsibility of federal government, it's a collective responsibility.
Yeah, the subnationals
at the
as well.
Subnational level, exactly. So we are also encouraging and continuously advocating to the subnational government to ensure that they allocate adequate resources to strengthen the facilities, because you will just have one teaching hospital or federal medical center in a state, but every local government is supposed to have a secondary healthcare facilities, and then primary healthcare facilities per ward. And now we are promoting a minimum of 2 PHCs per ward under this administration.
You know, in 2016, the federal government made a commitment to revamp about 10,000 PHCs, at least one per ward. I don't know where we are with that.
So yes, it's a continuation. That is the good thing about our party, APC. Let me come into that, because most of the problems we have in Nigeria is lack of continuity. Another government come and then stops it. So in the last administration of 8 years of the APC, the commitment was to do 10,000 with 1 PHC per ward. And yes, I'm glad that they have done about 8,000 primary healthcare facilities. Okay. And that is what you are reading as 20%, and that is just about 20%.
Yes.
So this administration is continuing. So there's a seamless transition, because the vision remains to attain UHC. So we are continuing, and we are saying that 1 is grossly inadequate. At least, not just 2, but minimum of 2 functional PHCs per ward to be able to provide services to people. So you're talking about a local government in a state, for instance, one local government in a state that has maybe a minimum of about 12 wards. So you're talking about at least 24 functional primary healthcare facilities
in a local
government. And that local government should have a general hospital, which is a secondary level of care, that becomes now a hub for referral from the primary healthcare facilities in case of emergencies and cases that they cannot manage. They quickly refer it. So that teaching hospitals or secondary facilities also, there is an existing teaching hospitals in all states of our federation, or a federal medical center, or a specialized healthcare that also serve as a higher level of referral. So this is what the situation we're trying to ensure that it exists in Nigeria, and we've started working towards that implementation to increase the PHCs. But as I said earlier, the subnational level have a big role to play. So if federal government is only supporting 2 through the BHC funding, basic healthcare funding, then the state should be able to ensure that this happens across all the wards of that local government of their state.
Okay.
Yeah.
You know, you cannot talk about health without talking about the burden of malaria, which is a very huge burden in Nigeria today, with Nigeria contributing about 27% of the global burden of malaria. How concerned is this administration about that, and what is happening in this aspect?
Yes, so as I said, integrated quality healthcare delivery, one of which is focusing of, because you break it down into several components. And one component that we are concerned is health education. Let me put it that way. Health education, where it all encompasses health promotion, protection, and then prevention from diseases. So malaria is one of the major killers. You've talked about the magnitude of malaria in Nigeria. But the worst part of it is that it affects mostly women and children under 5 years. It's a major cause of miscarriages, abortion. It's a major cause of premature deliveries. It's a major cause of death of neonates and children under 5 years. So we cannot ignore it and move forward. So it's one of the critical communicable diseases that this administration is positioned to address it. And we are doing that. So one major thing, one will say we've been on the fight for malaria for a very long time. So the fight continues until the end of malaria, just like the success stories we have recorded in the HIV and AIDS fight and other diseases. So, you know, about malaria, it's all about the individual and then the exposure to the mosquito and then the habitat of the mosquito. So beyond the health sector, it has environmental issues. So simply what we say in public health, the ABCD of malaria. First of all, you have to be aware, and that's what I mentioned first about the health education.
Education, yes.
Each Nigerian have a right and also have a responsibility to know what is malaria. How can I protect myself and my family from malaria? It is a responsibility of individuals at family level, at community level. So protection is first. And preventing, because you have to know that you don't want to come into contact with what causes malaria. It's just like, say, if the snake is coming into this room, everybody will start running. And you make sure your environment in this NTA is protected from snake.
Yes.
Isn't it? By fumigation, by
clearing the grasses.
Exactly.
And all that.
But you know, we underlook and underestimate that small mosquito, which is very dangerous. So without the mosquito, because it is the vehicle that transmits the parasites. Yes, the Anopheles mosquito. It transmits the parasites. Without it, you cannot. So the host is the individual. It's me and you and every other human being, plus the mosquito. So if the mosquito does not carry it to you, does not bite you, so first you must prevent yourself from the bite. And that is the B I'm talking about. After the awareness, the bite of the mosquito, you must avoid it. You shouldn't allow that mosquito to bite you. How do you do that? There are insecticide residuals that you can spray into. There are also mosquito nets, insecticide treated nets that are available. That you have to lie under that net, not just to go and place it and leave. You know, there's a story of an individual that when they gave him the mosquito net, he went and placed it in front of his house and said, this is the house for all the mosquitoes. So you see, it's education.
Yes.
So we as healthcare providers within that space, we must educate. So that people, even when you give the mosquito net, they know how to use the mosquito net.
Proper use of
mosquito nets, you know, so that you don't have that bite by the mosquito. So those are things you can do as individuals. And then the mosquito itself, alteration of the environment where the mosquito thrive. If it doesn't have a place to thrive, it will not be there. There are countries that have completely eliminated mosquitoes that bite people, that carry. And then the mosquitoes might even be there, but they are not carrying the parasite because over time they have no parasites to carry. So we must ensure that our environment is clean. They don't have residuals where that they can breed and grow the larvicides inside. So all those things, they have to happen. So, okay, now you are in fact affected with the mosquitoes. You must have early access to diagnosis and prompt treatment. The moment you start feeling the symptoms, you must report to a close facility so that it can be detected, it could be diagnosed immediately. And now we have moved forward in terms of technology has advanced, whereby you don't have to wait and come back after a few days. Immediately, using the rapid diagnostic test,
you get the results.
You get your result immediately and know that you have malaria, and then treatment will be given to you. So other people that have never been exposed, like foreigners, when they come, they also use the chemoprophylaxis to protect them from malaria. But we are in an endemic situation in malaria, where we have been exposed to malaria. So it's the test, you must do the test, detect malaria, and ensure that you have access to that treatment. And the treatments have been proven to be very, very effective.
Okay, we know that this year the global community and the WHO is focusing on accelerating the fight against malaria for a more equitable world. We would like to know some of the interventions that Nigeria is putting in place to ensure that we are at par with the rest of the world in terms of eliminating and fighting malaria.
Yeah, so there are all the 4 areas that I have mentioned, you know, eliminating the transmission of malaria, and also the vector control aspect of it, which has to do a lot with environmental actions that need to take place, but also there are development now and progress in the use of the vaccines against malaria, which has taken a very long time, but it has been rolled out in about 3 African countries and has been proven to be very effective. So Nigeria should also take, we are taking leverage of that to see how we can, Nigerians will have access through our facilities to the vaccination against malaria. But I can tell you that it is preventable. We can eliminate malaria with all concerted efforts and sustained commitment.
Okay, when I was reading your profile earlier, I saw that you established the pioneer program for HIV treatment at the Federal Medical Center.
Yes.
Tell us more about
at the Federal Teaching Hospital, Federal Ministry of
Federal
Health.
Ministry of Health,
Yes,
rather.
yes.
Yes. Okay.
Yes.
So let's know about that.
So you know, the early days of HIV, it was a big scare for most people. People see it as a death sentence. So I was opportune when I came to the Ministry of Health, and I worked on the National AIDS Control Program, where the coordinator that time was Dr. Nasir Sani Gwarzo, who is currently now a permanent secretary. So we worked closely together, and we developed all the framework with the support of our development partners. So that time, the focus was on prevention. You know, Nigerians, Africa generally is not talking much about treatment. Yes, or even prevention of transmission from mother to child that is mother that is infected. So we were able to put an advocacy group, because that time developed countries, the USA, the British, the Canadian, people that live there, they have access to treatment.
Okay.
But at a very high prices. So Africans didn't have access because of the cost. So we were able to work and bring out people living with HIV/AIDS for the first time and support them to establish what today exists as a network of people living with HIV/AIDS. So we show the face of people with HIV/AIDS, that it is a reality. Because then there was a denial that it does not exist. You know, it's not an African problem. But then people living with HIV begins to come out and give testimony that there are people living with HIV/AIDS. They don't have access to drugs, and people are dying. So I just want to recall back the story and mention it was under the time of President Obasanjo, President of the Federal Republic of Nigeria. So we went on a World AIDS Day, and then we had also, I must mention, Senator Hairat, who was the chairman of the committee, very active, and she worked with us very closely. So we went on an advocacy visit to the president. And then President Obasanjo was really shocked that Nigerians do not have access to treatment. Not only Nigerian, but African countries. So he said it's unacceptable. And he is going to mobilize support for Nigeria. And to God be the glory, he mobilized support for Nigeria immediately, because he reached out to Kofi Annan, the UN Secretary General of at that time, spoke with him, spoke to President Clinton, and how do we mobilize support for Africans to have access? How do you reduce the prices of antiretroviral drugs so that Africans will have access? They don't die. This is not equity. We must have equity in access to that. And then it started from there. So the president convened meeting of all heads of states of Africa. About 44 heads of state came to Abuja, the International Conference Center. And then they also mobilized the developed African countries, about 7. And that was what led to the Global Fund to fight HIV, AIDS, TB, and malaria.
Okay.
And Nigeria was the first African donor to donate $10 million as of that time. And we applied for the first grant, and Nigeria was the first, was one among 7 countries that benefited from the Global Fund. Until today, Nigeria is also benefiting from the Global Fund. Almost every round of the Global Fund. It was just launched this year. What we got last year, the proposal was completed last year, and it was launched this year. So Nigeria continued to be. So I want to tell you that Nigeria is a big mobilizer. And this is one classical good example of how we came about the Global Fund to fight HIV, AIDS, TB, and malaria. And then we established also the prevention of mother-to-child transmission. So as of that time, Nigeria benefited from the antiretroviral therapy support by the Global Fund, and also the prevention of mother-to-child transmission and community intervention activities on prevention and control measures. And then later we had the PEPFAR Fund from the US government, which also provided a huge support in addition to other supports that come into the country. So I think that is a success story for Nigeria to learn from in the health sector.
It is. We are running out of time now. So just briefly, what should Nigerians expect from the Tinubu administration in the health sector?
So Nigeria...
take this as your closing thoughts.
Okay.
Yes, ma'am.
Thank you. So Nigeria should be very, very optimistic that the Renewed Hope Health Agenda is committed, to revamp the healthcare systems generally, to ensure that all Nigerians, irrespective of your sex, gender, irrespective of your socioeconomic status, your religion, wherever you are, you will have access to basic minimum package of healthcare services within a nearest primary healthcare facility, which should be covered by the insurance. And I think that, and I also cannot go without talking to women and children, because Nigeria contributes the largest burden of women that die from pregnancy and childbirth. So women should be hopeful also, and should be happy that this administration is committed to accelerate reduction of maternal death by ensuring that all maternal death services, including family planning services, are available within the primary healthcare facilities as part of the total package of healthcare delivery.
All right.
So join us and let's do it together.
Okay, and this is where we wrap it up on this edition of Late Edition. We wish to take a moment to appreciate our guest for her time and contributions on the program, Dr. Salma Ibrahim Anas, Special Advisor to the President on Health. It was a pleasure speaking with you, ma'am.
Thank you so much. Thank you.
And I am Ekene Ndulwe. Thank you for watching.